I have in studio with us Don Mitchell. He is the council chair, and I'm going to read this out because I might say it wrong. Muskoka and Area Health System Transformation. Healthcare is an important part of our community here, of course, and you're here to give us an update on this council, on how we're doing here. Thank you so much for coming in.
Thank you so much for having me.
No problem. It's important that we do have you come in and discuss with our viewers all about what's going on with our healthcare, and MAHST, which is it's also known as, is an integral part of that. So let's talk about what's been going on since the announcement of the committee, since it's been rolled out.
Well, the big thing is that we have formed an executive committee. Mm-hmm. If you would think of it as a steering committee. We have a project that we're focusing on trying to get accomplished in the next year. The goal of that particular project, or the project phase, is to develop a model of care for health in Muskoka, and to come up with an implementation plan to see how we're actually going to roll that out. And if you kind of think of things in a pyramid kind of shape, we're looking to achieve better health, better care, and better value.
Now, I mean, I'm sure there are viewers out there who are probably wondering, I mean, it's a steering committee and that's all fine and good. Now,
that's just one part of the group.
That's right. But
yeah.
this project that you want to take part in, I guess my question for you is it something that will definitely be implemented and used? Like, will the province take a look at it and be like, yes, we are going to use this to help better our health care?
Excellent question. The proof will be in the pudding, obviously, once we develop the plan. But certainly, every indication that we have is that we have the support of basically the local health integration network, who is funding this particular project with the goal of implementing the model that is designed by the people of Muskoka for Muskoka.
And let's also just do a little bit of clarification as well. This is not something, it's not against Muskoka-Algonquin healthcare. In fact,
Absolutely
it's
not.
working in conjunction with, in many ways, in many aspects, you are utilizing their expertise too. So let's just talk about that a little bit and how they play a role.
Well, let's just take a step back and say that this is community-based, and they're a member of the community, and they're participating. But they're not the only member. And so the goal is to bring everybody together to look at how we can integrate the services that are currently being delivered in Muskoka by all providers. We want to come up with a system that is going to help, if you would think of it from the point of view, provide better care. And, you know, we bandied around the term seamless, you know, having a person be able to move through the continuum of care without difficulty. We'd like to try and achieve that. Mm-hmm. Maybe seamless is not quite the word we should use, but the integration component. So we want to have all the parties talking in an effort to ensure that the healthcare that is being delivered is in the right place at the right time.
Now, could this conclude funding model changes, perhaps different levels of care of where the services are provided, in which way?
So if you think about it, the model is going to come up with a basket of services, those things that we absolutely have to have in Muskoka. And once that model is developed, it's going to be looking at how the model will be delivered. And so are things going to change? Yeah. But they're going to change for the better. Okay. It's too early to tell whether it's kind of one hospital, two hospital, but the whole goal is to make sure that each and every Muskoka resident has access to the best care that we can give them at the right time. And I think, you know, it goes without saying that we have really good health care now.
Absolutely.
But continuous improvement. Mm-hmm. That's the word that everybody uses today. And we want to look at how we can improve the system and make it better. So
of course, it is the early stages, as you said, to say what that's going to look like. So let's talk about Timeframe. What is the council or MAHST looking for in terms of Timeframe?
So what we're expecting is late spring of 2017. We're expecting to have the model of care designed and we're expecting to have an implementation plan. In 2018, it'll be the starting stages of putting that framework in together. And the goal is to actually have something in place by 2022.
Okay.
So it's an ambitious time frame, but certainly the team so far feels that it's well within our reach.
And how are you doing as chair? How's the workload? How's it going for you?
The workload is okay so far,
Good, yeah.
but again, it's early stages, and I think that I am very fortunate to be put together with basically 8 other people or residents of Muskoka that are really top-notch people. And I have to tell you, if there's one thing they all share, actually 2 things: passion for Muskoka and passion for healthcare in Muskoka. And I think with this team, if anybody can do it, this team can do it.
Perfect. Well, thank you so much for taking the time. I'd love to have you come back at some point as the updates roll forward and devote a little bit more time to talk about how those things are going to roll out.
Okay, thank you so much.
Thank you. So again, this is MAHST with the update. Don Mitchell here, the council chair with MAHST, giving us the update. And if you want to have any more information, is there a website by any chance?
There is a website through the district of Muskoka, but we will be, as we start to roll out, there'll be more easier access for communications.
Okay.
I do have something if you have just a little bit more.
Sure.
I have one little concern.
Okay.
And so it's probably more of a plea, and that is that we're really looking for the younger people in Muskoka to engage.
Okay.
In everything we've done so far, and we've seen with the hospital and everything else, we have the older generations actively involved. But this truly will be an opportunity for the younger Gen X's and the millennials to have a say.
Of course.